I'm Dr. Cecil Bennett. I am a family physician. I feel it necessary to speak out due to my concern regarding the plan for the distribution of the COVID vaccine. I am concerned because the plan I've heard so far for distribution of the vaccine seems to be very similar to the plan deployed at the beginning of the pandemic for testing that said, everyone who wants a test will get a test. At the time, the COVID testing plan called for the training of new workers, setting up tents, and having results back in 24 to 36 hours. By any measure, that plan did not work. So please, send the vaccine to the state governors and have them send the vaccines to us.
Wow, thank you, Dr. Bennett. I think your message is clear and strong. And tell me, why hasn't this happened?
That's a very good question. I've looked at broadcasts from the CDC, the NIH, the FDA, and at no point they're incorporating primary care physicians in the equation whatsoever.
And as I asked sort of before we got on the show, again, what difference would it make, do you think, if primary care physicians were brought into the picture?
Well, I'm a former member of the membership commission for the American Academy of Family Physicians that represents 120,000 family doctors across the United States. We're in every community. We're in the inner city, we're in rural communities, we're in farm areas. So literally, we're in every part of the country from East Coast to West Coast. We have electronic health records so we can easily manage our patients, and we have relationships with our patients. So it'd be very easy for us to vaccinate the majority of Americans in a very short time.
Thank you. You know, we have joining us the president of Howard University, Dr. Wayne A.I. Frederick, who has also been, I think, an astounding voice, not only for people staying safe from the virus, but also now he's had the vaccine and also has a message. But welcome to the show, Dr. Frederick.
Thanks for having me.
So I guess you've heard Dr. Bennett and understand the issue that he's raising. I know we were going to talk about some other things, but I wanted to give you an opportunity to maybe weigh in on his thoughts.
Yeah, I think he's spot on. The logistics of the distribution of the vaccine is critical, complicated but critical. And I think the best way for us to go about managing that, as he so rightly pointed out, is we have to use the common pathways that patients are already comfortable with. And one common pathway that patients are very comfortable with are their primary care physicians. And I have argued very strongly that they should be at the forefront of any algorithm that involves getting the vaccine out to the community. The community, they're going to go to trusted faces, trusted voices. And many people will tell you, I'm not going to do that until I talk to my doctor. And if your doctor says do it, there's a far greater chance that they'll do it.
Oops. I'm sorry. I got rid of myself. Maybe you all could have a great conversation and I could just sit back because doctor to doctor, I think it makes a whole lot of sense. Dr. Frederick, you've had the vaccine. I don't know if you had it. Have you had it yet, Dr. Bennett?
Yes, my second dose is due on Sunday.
So I'm curious to hear from both of you. Did you have, were there any effects of the vaccine that you can talk to us about?
Yeah, so I had my first and second doses. I had my second dose earlier this week on Tuesday. After the first dose, I was fine, a little soreness in my shoulder. And then the next day, I had what we call myalgias, just general muscle aches, achiness as you would have if you got the cold. We sometimes confuse that with, getting the cold or the virus. And really what it is your immune system is reacting. And that's part of kind of the entire syndrome of symptoms or constellation of symptoms that you get. This time with the second shot, I definitely had more of that reaction on the first day as opposed to the day after. I took it on Tuesday, felt that way, went home and got in bed, and by the next day, I was perfectly fine and have no residual symptoms now.
And Dr. Bennett, what about yourself?
Well, for me, I had zero symptoms. I'm sorry, Dr. Frederick, you went through so much, but my arm wasn't sore. I felt perfectly normal after the first dose. So we'll see what happens after Sunday.
So how do you all feel about communicating this message to particularly African Americans who are leery of vaccines? I think now that individuals like yourselves and so many frontline workers, we've seen pictures upon pictures, videos of all people getting these vaccines. But how are we addressing the fear or concern of African Americans about getting the vaccine?
Yeah, two things. I think one, we have to look at the data. The studies that were done demonstrate that the vaccine is well tolerated and safe. And so I think we have to educate. We're not trying to force anyone to take the vaccine, but what we're trying to make sure is that they have all the information so they make an informed decision. But the second thing is a little different. I have a slightly different perspective on my second point here, and that is that just think of late April, May, starting to get warm. Significant numbers of people have now had the vaccine and are beginning to go out, open up the economy. The people at the front line, the people who will be waiters and waitresses, cashiers at grocery stores, and in other places, hotels, people who are cleaning, uh, doing custodial work, those people now are going to be exposed. And if those people are minorities who have not received the vaccine, they run the risk of contracting a virus from people who, while they will have less chance of transmitting the virus, will not get sick. You'll have more asymptomatic spread then. And unfortunately, the most vulnerable population is the population that already has been hit hard. And we can have a crisis in the African American community at that point. And so I think it is critical that we get significant numbers of African Americans to have the vaccine when it's appropriate for them to do so, to avoid what I think could be a catastrophe in the early spring.
Dr. Bennett, how do you feel that your argument, what you're trying to stress, how do you think that's going to change? Are you being heard? Do you think that physicians will finally get a chance to be a part of this army of protecting Americans?
Well, I think it's going to be important, and I'm glad that Dr. Frederick is speaking out about the need for primary care physicians, because I really believe that's the only way we're going to realistically get a significant number of African American and other Black and Brown people immunized. But let me say this too about some of the misinformation that's out there within our communities that I really wanted to dispel. You know, there's a lot said about the Tuskegee experiment and how people don't want to take the vaccine because of that. But let's be clear about that. The Tuskegee experiment took place in Macon County, Alabama, from 1932 to 1972, where Black men were not infected with syphilis. What happened was the U.S. Department of Public Health and the CDC followed men that were infected, a little over 400 men that were infected already with the virus, and did not treat them for over 40 years, which is unethical. So that was a situation where men were infected and were not treated by the federal government. When it comes to COVID, our community is more disproportionately affected by this virus. And the government is saying, we want to vaccinate you, we want to protect you. So I believe getting the vaccine actually honors those men who took place in that, who were a part of that unethical study, and not getting the vaccine actually dishonors their memories.
Interesting point. Interesting point. So the rollout of the vaccine, of course, is still, if primary care physicians aren't in the picture, we're looking at pharmacies. We're looking at, as Dr. Frederick said, grocery stores, different places like that. But I think people are still trying to figure out where they're going to stand in line. I know that we've been seeing people over the age of 65 standing in long lines waiting to get a vaccine. We're concerned, and Dr. Frederick, that I'm curious about your students at Howard. Will a vaccine be required in order for them to come back to school? How does that work once it gets down below, say, those frontline workers and the seniors?
Yeah, so it's a good question. Actually, right now in our algorithm, we have included our healthcare students who are doing clinical rotations um, in our frontline staff. So they will be getting the vaccine fairly soon. When it comes back to school, we follow the DC Department of Health regulations. They have immunization requirements. If they add a COVID-19 vaccine to it, we will certainly then require it by law. Um, Regardless though of whether they add it or not, we will be encouraging our students to get it, because while it's highly unlikely that they will contract COVID and get very ill, they will be in touch with our faculty. We employ more African American faculty than any other higher ed institution in the country, and as a result, we have a responsibility to ensure that that faculty is protected. And one way to do that is to avoid them coming in contact with students who may have the virus. And so we will be encouraging them to get vaccinated as much to protect our elders, as it were, in the community. So we're all in this together.
You know, this is a totally different conversation, but I want to give credit to Howard University, where I transferred from another school in my junior year of college. Howard had the requirement that students take a sickle cell test. It was the first time I'd had one. It was the first time I realized I had the trait. It was the first time that my father realized he had the trait, because of the medical clinic on the campus, not the hospital, the clinic on the campus of Howard University. So I had to commend you all for that. And it was life-changing, actually, for us. But when you all saw, I just want to go back to what we were talking about a little bit earlier, and saw this event happening in our nation's capital, at the Capitol, and what I call the super spreader event. I mean, what went through your mind, not only as it relates to just the crazy violence and stuff that was going on, but the fact that there were thousands of people unmasked? What does that mean? And what is the impact of that, did you think, when you saw it?
You know, that's the America we live in. I keep hearing people referring to what happened a couple of days ago as it was un-American. I think that's a mistake. That is the America we live in today. So we live in an America where we are facing a pandemic, and a very large number of the population do not believe in the serious nature of it, because quite frankly, when they have contracted it, they wouldn't die from it. What they fail to realize is that we are losing seniors at a very, very high number, and we are exposing frontline healthcare workers that we're losing far more than we would have lost in other years. The other thing that I think they're also failing to realize is that the longer the pandemic goes on, we're actually affecting the health of everyone. Because ultimately, if you look at something like cancer screenings, it's down 89% because people are not going into hospitals. So we're going to have an explosion of people with colon cancer and prostate cancer, with late-stage disease. And again, disproportionately, that affects our minority community. So unfortunately, this is the America we're living in today.
And I would add that, over my shoulder is a painting of John Lewis, who one of my patients actually painted for me. And I wonder what he'd be thinking based on what we saw happen a couple of days ago. And, as a healthcare worker, I see all those people are unmasked. And if they get into trouble, they're coming to my office or going to the hospital, where we have to treat them because of, mistakes, let's just call it that, they were making the days before. So they expose me, they expose my family and my loved ones for no necessary reasons. But, as a physician, these are just things that we encounter, and we deal with it. We mask, we do what we need to do to treat our patients, regardless of the circumstances as to why they come to us.
So I know we're getting to the end of the program. I want to give both of you all an opportunity to give sort of a closing remark, an appeal, whatever's in your heart or in your mind, before we end. And I'll start with you, Dr. Frederick.
Yeah, first I want to commend you and the Washington Informer for putting this on. We have to get the word out. We have to continue to educate our community. I want people to get information. That's what my request is. I don't want you to go out and get a vaccine if you're unsure about it. What I want you to do is to seek advice from people like Dr. Bennett in your community. And then once you get that advice, you need to make a decision. And we hope that the decision you make would be to get the vaccine.
All right. Well, Dr. Frederick, stay safe, stay well. And thank you so much for being with us. And feel free to come back anytime
Sure,
if you have
thanks
more
for
to
having
share.
me again. Both of you guys stay safe, and Dr. Bennett, please continue doing the things you're doing. We appreciate you.
Nice to speak with you as well. And
And
I would say that my final message would be, you know, we're in a time now that's very difficult, but we can get through this. I mean, we can be back to normal within the next, I would say, 7 to 8 months if primary care physicians are considered the tip of the sword when it comes to vaccinating America. So I'm really imploring everyone listening to me to contact their state senator, sorry, their state governors, and to have their governor contact their state Academy of Family Physicians. They'll get access to a database of thousands of primary care physicians across the entire state. They can put together a portal, and through that portal, they can start sending physicians like me vaccine. So in a very short period of time, we can have this pandemic behind us if, again, primary care physicians are incorporated at the front of the pandemic front line.
Dr. Bennett, thank you so much for being with us, and thanks for bringing up, that issue, something that a lot of us don't even think about, but we're glad that you're there, and Dr. Frederick and so many others that look like us in the front lines of helping to protect our community. So we wish you well, and thank you again.
Thank you very much for having me, Denise.
All righty.